Hello everyone, I'm Hannah and I'm excited to tell you about my Capstone project on radiology student conferences. So to start, I would like to tell you a little bit about myself. I am an X-ray technologist at Overlake Hospital, which is here in Bellevue, and I've been with Overlake for about 4 years. So 2 of those years were spent as a student in the radiology program at Bellevue, and then 2 of those have been spent as a full-time technologist while I've been completing this bachelor's degree. I'm also one of the student coordinators in radiology, which is basically a liaison between the college and Overlake Hospital. So some of my tasks include onboarding students, scheduling their rotations to different departments, monitoring their competencies throughout the clinical program, and then also providing quarterly evaluations of their progress through the program. I included a picture of me during my very first day at Overlake with a couple of my classmates. I was so nervous and so excited, so I barely remember this photo even being taken that day. So my capstone project idea was to incorporate regular conferences into my students' clinical internship. So what even are clinical conferences? Well, in a hospital setting, these are going to be regular meetings involving a facilitator, which would be the student coordinator, and a group of students. And you can do a couple different things with conferences. A popular one is simulation-based learning, so doing mock exams. Or you can have discussions around complex exams or patients that the students had encountered that week. And I think that they're really important in a radiology setting because it provides an opportunity for students to practice their positioning skills, their patient care skills, which impact their competence and confidence during their clinicals. Overlake Hospital is a level 3 trauma center, meaning in our ER, we're going to see patients come in with complex skeletal injuries like shoulder dislocations or open fractures or spiral fractures. When these patients come into our ER, they're in extreme pain, and most of them cannot move themselves or position themselves for an x-ray, as opposed to when patients go to a walk-in orthopedic clinic, they can do just about anything. So this requires our techs to perform trauma views where we work around the patient. And students have a lot of difficulty comping these exams, especially during their first year. And this is observed through pretty low comp numbers for their first 2 quarters. And then every student I've had this year alone has come to me and expressed uncertainty in their abilities to perform these exams. Trauma views in school are not taught until about 3 quarters into the program. So these clinical conferences that I'm proposing would help bridge the gap in knowledge for Overlake students, especially first years. Simulation-based conferences will help students increase their confidence because they'll be positioning their peers for trauma views and then applying that learning to real patients. When I was a student, in my experience, I remember struggling with this exact same issue. I really would have loved to have these regular meetings to practice these views. So my goal with this project is to introduce clinical conferences on a regular basis to my students, and I want to see if their positioning confidence improves afterward. My project design had 3 steps, and the first one was to create some surveys for my students to respond to. So I couldn't just impose these conferences on them without ensuring they were a valuable addition to their clinical time, so I just wanted to start by surveying their opinions. All of them really jumped in the idea, and they were really excited to participate, so that was awesome. I sent a follow-up survey which assessed their confidence levels in performing shoulder x-rays on trauma patients. And I chose shoulders as the topic because Overlake patients are notoriously difficult. We get a lot of patients on spinal precautions, and they come in with the cervical collar on to protect their spinal cord. This makes it really difficult because we're not allowed to move them or turn them or roll them at all for any positioning. So once I gathered their responses, I created this conference agenda for shoulders. And we were basically going to simulate a co-trauma where a patient comes in with that cervical collar and they need right shoulder x-rays. And based on my students' individual responses, I focused a little more time and attention on the views that they said they were least confident in. And then after the conference, I plan to send the exact same surveys before to see if those confidence levels improve. So I'm going to break down each of these steps a little bit more in the next few slides. To expand on the surveys just a little bit more, I included a photo of what was sent to my students on this slide. So they all received an email from me with a link to this Google survey. I included 3 scenarios, which all based on exams I've done in real life, and I asked how confident students were in obtaining each view for each scenario. So they could respond at a scale of 1 to 5, with 1 being, I've never seen this view performed ever. to 5, which is I could do this without any help. Results were submitted anonymously to my inbox, and on average, students reported anywhere from like 2 to 3, with a couple of 1s sprinkled in there. So the general consensus was they had little to no confidence in performing the view, or they could kind of perform the view, but they really relied on tech assistance. So for the fun part of my project design, we actually got to hold our trauma shoulder conference on May 1st. I included a photo of my lovely students, and then I recruited my coworker Ashley to help by playing the patient, and she's in the middle in the green. So we simulated all 3 of those scenarios that I described in the survey. The first was a 37-year-old male arrives to the ER after a ski accident. His arm is in a sling, and the ER physician thinks it's likely dislocated. The second scenario is a 56-year-old male that fell off a ladder at work, and he hit his head and his right arm. He arrives to the ER with a cervical collar on, and he cannot be moved, turned, or rolled in any way until he gets a head and neck CT and until the results are in, which could take up to an hour. And then the final scenario is an elderly patient, and she has chronic shoulder pain, and she cannot abduct her arm for an axillary view. And the point of that view is to get the arm away from the body, so that makes it pretty difficult. So my personal teaching style is to be as hands-off as possible. So what I started with was Ashley and I ran through each scenario to demonstrate the views in the workflow. And then I assigned a pair of students at a time to take over and perform the exam. And while they were doing that, I engaged the other students by asking them critical thinking questions. I asked them to critique their peers' positioning. We talked about some potential errors that they could make, the consequences, and then how to problem solve each of them. And then I had each student pair run through this scenario, and they all rotated, so everyone got a chance to practice. So the third step was to see if these conferences were actually a valuable source of time. So about 1 week after the conference, I emailed out that exact same survey as I did before, and I asked everyone to once again rate their confidence in obtaining trauma shoulder x-rays. So the table that you're currently looking at displays the average confidence rating on a scale of 1 to 5, and then it shows on the far right column if there is an increase or decrease from the pre-conference results. So as you can see, confidence improved drastically across all views. The most notable increases occurred for the axillary and the Grashy views. And if you don't work in x-ray, basically these views require the patient to move their arm away from their body and do some rotating, which is really, really painful to do if your arm is injured or broken or not in the socket. So it makes the most sense that these views had the most room for improvement. So taking a step back and looking at this project and its importance as a whole, I did witness an increase in confidence during the conference and then again in the post-conference survey results. And then, since May 1st, I have also personally seen improvement in my students' clinical performance. They've been getting faster, they've been getting more efficient in their workflow, their shoulder images are looking really good, and a couple of them have even gotten some shoulder comps since then. So it really reinforces my belief that implementing these monthly conferences will be beneficial for improving their confidence, and in the long run, their competence that can be transferred into these real-world exams. So with the success of this project, my supervisor has acknowledged the importance of student education and the long-term effects of hiring skilled technologists right out of school. So she believes this is a good use of time and wants to continue monthly student conferences where the coordinator can step off the floor for a couple hours at a time and engage in simulation-based learning. I've gathered all the data from this project and I have used it to create a student coordinator handbook for Overlake. And this handbook is where future coordinators can find potential conference agendas, contact information for the college, department resources, and how to even schedule these conferences to begin with. So this handbook serves as the final product of my project and a resource for future student coordinators. To recap this project, I experienced uncertainty at the beginning of my clinical internship. All of my students have expressed the same uncertainty, and this has prompted me to find a way to help them succeed. The level of complexity that our ER provides needs to be met with additional support during clinicals to improve confidence among our students. Regular conferences solve this issue by providing opportunities to simulate trauma exams, to learn positioning skills in a low-risk setting. Practicing these skills regularly will improve confidence in the material, and this confidence will transfer to real-life exams, as seen through not only my survey results, but my personal experience with these students. All right, thank you all so much for listening, and I really want to thank the Bellevue College faculty for helping me with this project, the Overlake management team, and most importantly, all of my lovely students. Thank you.